So, what about other antiviral options for COVID-19 in the outpatient setting? Well, in addition to the preferred first-line option, nirmatrelvir-ritonavir, there's the other first-line agent, remdesivir, and the second-line option, molnupiravir. Nirmatrelvir-ritonavir and remdesivir are FDA approved, whereas molnupiravir currently has an emergency use authorization. Aside from a shortage, some reasons why nirmatrelvir-ritonavir wouldn't be appropriate include if a patient's kidney or liver function were too poor. There were interacting medications preventing us from using nirmatrelvir-ritonavir, or the patient has swallowing problems or a gastrostomy tube and needs their medications crushed. This is because the prescribing information doesn't recommend chewing, breaking, cutting, or crushing the tablets. In those cases, remdesivir would be the next choice. It has few DDIs, and you don't need to dose reduce for kidney or liver function. Remdesivir is an IV medication, so logistics are potentially an issue. You have to plan where, when, and how the patient will get the infusion. The patient has to think about transportation to an infusion center and any additional costs that go along with infusions versus oral medications. Using remdesivir may be easier if the patient is in a skilled nursing facility or has rapid access to home health care.
If a patient doesn't already have home health care, setting this up quickly enough to get the infusion to the patient when it's still going to be effective could be challenging. Even if you can work around the logistics, a patient may not want an IV medication if they have another choice. And you may not want to introduce a 3-day course of an IV medication to a patient who's frail or at risk for complications.
Molnupiravir can be a good choice for people who are unable to take nirmatrelvir-ritonavir and those who can't or prefer not to take IV remdesivir. Due to concerns about efficacy, molnupiravir is only recommended in cases where the first-line options aren't available, feasible to use, or clinically appropriate. Molnupiravir is an oral medication that can be crushed, has no dose reduction considerations for kidney or liver disease, and has few DDIs. However, it's thought to be mutagenic, meaning that it may be capable of inducing genetic mutations. This is based on animal studies that showed birth defects, so we want to avoid this medication in younger adults, children, and pregnant patients, or patients who are breastfeeding. There's a boxed warning describing this risk, as well as a pregnancy registry if a patient is prescribed this medication while pregnant. To help you navigate through the various COVID treatment options, we've created a concise, user-friendly therapy selection flowchart. Using this will ensure rapid and informed decision-making for outpatient care. You can download it from the course resources section.